Good morning. Welcome to Chapter 24, Radiology. Today is supposed to be our live Zoom, but I'm doing a pre-recorded because I have to take care of a couple of other classes today. But you're still going to get the same information. We're just going to be recording it instead of seeing my beautiful face live, right? All right, so we're going to be talking about Chapter 24, Radiology. I do not want you to get overwhelmed. I want to remind you that you're not going to be an expert in every single chapter, okay? Remember, you're learning the basics, and if you go to work for a radiology company, then you will have on-the-job training for specifics. The biggest thing I want you to focus on is knowing the terminology and how to code most things. So I'm saying that because radiology is not always my favorite. It can stump me a little bit. So without further ado, let's start our share. Okay, Chapter 24, Radiology. Radiology uses radiant energy to diagnose and treat patients. The term radiology originally referred to the use of X-rays to produce radiographs, but now it is commonly applied to all types of medical imaging. A radiologist is a physician, a licensed MD. Radiologists can provide services to patients independent of or in conjunction with another physician of a different specialty. So think about that. If you go to the orthopedist and they suspect that you have a broken, let's say, right toe, but they do not have the equipment to x-ray that toe, they're going to send you to an independent radiology center to have those things taken care of. But you're still being taken care of by the orthopedist. They're just sending you to an they're outsourcing you, in other words. All right, so let's talk about how our radiology section of the CPT is actually set up. We have diagnostic radiology, and these are going to be your green headings. So if you look on page 526 of your CPT, you're going to see diagnostic radiology or diagnostic imaging in green. And I'm looking for the next one, which would be aorta and arteries, diagnostic ultrasound, radiologic guidance, breast mammography, bone joint studies, radiation oncology, clinical brachytherapy, and nuclear medicine. Let's talk about an MRI. MRI stands for magnetic resonance imaging. Magnetic resonance imaging. MRI is the use of nanonizing radiation to show the body in a cross-sectional view. Okay, so if you remember last week, we did body planes for bell ringers. This is why I wanted you guys to kind of have some knowledge on body planes before we moved into radiology. An MRI allows for obstruction of soft tissue structures. I'm sorry, let's read that again. An MRI allows for observation of soft tissue structures. MRI codes are divided by with, without, or without, followed up by contrast. So you're going to have with or without contrast or completely without contrast. If it says no contrast material, you're going to actually use your CPT code that says without. Now, if the CPT code only says with or without, it doesn't matter, because that CPT code is going to cover everything with contrast materials or without contrast materials. MRI codes are divided. I'm sorry, I just read that. The MRI codes are found in the body area that is being viewed. So if you're doing your chest, it's going to be chest. Remember we talked about the big toe? It's going to be in that body area, which would be lower extremities for the big toe. So back to MRIs a little bit. Let's talk about an MRA, a magnetic resonance angiography. Is the application of the MRI that provides visualization of blood flow as well as images of normal and diseased blood vessels. Now, all of these pictures or diagrams are coming from your textbook. So please know that you're going to run into this image again in your textbook. Now we're going to talk about tomography or CT. Tomography or CT is the view of a single plane of the body attained by blurring out all the layers. The CPT code for CT scans are found under the body area that is being scanned. So are you seeing you're going to find your main term, which would be like tomography or CT, and then you're going to go to your body area. CT scan of the brain, CT scan of the lungs. You're going to be breaking it down by the body area. So this is a CT scan of a lung carcinoma. And again, this is in your book. It's broken up into an A, B, C category here. So let's just do A. A patient with right hilar lung carcinoma and metastatic okay, let's try again. Let's say it slow, right? Miss Marcia, come on. Adenopathy, showing the margins of the bones. So that is what is being described here. That's what you're seeing. So the next thing we're going to talk about is two very, very important radiology modifiers. Modifier 26, which is called the professional component, and modifier TC, which is technical component. So when is a modifier 26 used? Modifier 26 is used when only the professional component is being billed when certain services combine both the professional and technical portions in one procedure code. Really think about it and decide what CPT codes require a 26 modifier. Now we're going to talk more about it, okay? Don't worry. So modifier TC, which is your technical component. What you need to know about modifier TC is it is used when only the technical component of a procedure is being billed, when certain services combine both the professional and technical portions in one procedure code. Use modifier TC when the physician performs the test but does not do the interpretation. So let's learn a little bit more. So look here, we're having a mammogram, right? So professional component 26, the physician portion of the service includes supervision of the technician, interpretation of the result, including a written report. So let's talk about the TC component. TC is the technologist service, equipment, film, and supplies. So let's go to our big toe again. The doctor is going to send us out to an outsourced radiology department. They're going to take our film. They're going to use their equipment. They're going to shoot the CT. They're going to shoot the X-ray with their X-ray machine. So they're using their equipment, their film, and their supplies. The technologist does this, the radiologist. He then compiles all of that information into a report and sends it back to the physician. The physician is going to read and interpret what he sent. Let's go back to 26. So supervision of the technician, the physician shows the technician, sent the patient out. Patient went, brought, and the technician sent all of the supervision, all of the notes, results back to the physician, including the written report, and the physician interprets it. That's what 26 is. The technical component is only your technician and the radiology machine. The supplies, the film, things like that. Okay, I hope you understand those two. I hope that I explained them in a way that made sense. So an overview of radiology subsection is going to be diagnostic radiology, diagnostic ultrasound, radiologic guidance, breast mammography, bone, which is in joint studies, radiation oncology, and nuclear medicine. So let's talk about diagnostic radiology. Let me move my little doohickey up to the top so we can see all of it. Complete is a very important word to remember when you're coding radiology. Complete in a code description in radiology section means all views taken of specified body site. So complete means the whole body section. The most standard radiographic procedure, it's the most standard radiographic procedure. Codes often are divided on whether there was contrast material used. Codes further divided on number of views. There's more information, just hang on to go along with this. So contrast material. Many radiology procedures require that contrast material be injected into the patient to make certain organs or vessels stand out clearly on the radiographic image. Codes in the radiology section describe only the radiology procedures, not the injections or placement of other material necessary to perform the procedure. Codes are often divided according to whether contrast materials were used. The phrase "with contrast" means that the contrast was administered intravascularly, intra-articularly, or intra-athalcy. We're going to go with that, okay? You guys know I butchered these words, but when I try to get you to help me in class, you butcher them too. The biggest thing, remember, it's not that you know how to say them, it's that you know how to look them up. Many radiology procedures require that contrast material be injected into the patient to make certain organs or vessels stand out clearly on the radiographic image. Codes in the radiology section describe only the radiology procedure, not the injections or placement of other necessary materials to perform the procedure. Codes are often, I think I just read this one. I did. I put the page in twice. Well, that's okay. That is all right. So those are the slides that we're going to go through. And I do apologize for having a repeat of that last slide, but I was excited to get it in there, I guess. What I want to tell you is that I am going to be adding a YouTube video to review how to code radiology. If the lady that is on this YouTube video, if you do not subscribe to her, I do not recommend much, but please subscribe to her channel. She breaks down things and has equipment to do things that I do not. So this is your lecture for today, but you're going to, in addition, have a very, very important video to watch. It's 15 minutes. That's why I kept the lecture short. Have a great day, guys. Have a wonderful weekend. Please remember that the final exam for 154, I pushed it and I left it open till tonight, but after that, I can't do any more for you. So if you haven't finished up 154, the exams, you have until tonight, 11:55, and then they're gone. So if you have any questions, please let me know. Have a wonderful day. Talk to you guys soon. Bye-bye.